afternoon, everyone, and welcome. And thank you for attending today's error prevention education training. And my name is Mirasol Fuerte. I'm the administrator for Sutter Hospice. And presenting with me, who's not here right now, is Jam Barion, one of the DPCS for Hospice, and Angelica, the AIM clinical lead, and my assistant, France. So, today we will be talking about Sutter safety and reliability journey. When you hear the word reliability or being reliable, what comes to your mind? Anyone? Or else I'm gonna start pointing for volunteers.
When you say you're going to be
Reliable,
somewhere. When you say you're going to be
reliability.
somewhere, you're going to be there.
Okay, sounds good. Anyone else? I hear something. Consistent. You can also think about being dependable. So basically, we will be talking about how you can be a safer and more reliable employee and making sure that you are giving the safest care possible to our patients. So our goals for today is we're going to commit to this Sutter safety and reliability journey. At the completion of this session, you will be able to describe the goals of Sutter Safe Culture, identify how error prevention tools create a culture of safety. That's what we're going to give you, and we're going to have videos and exercises on how you can practice. Before we start, let's cover our ground rules. This is going to be interactive, so if you have any personal stories or patient stories you want to share, please do so. Cell phones, please have them silenced. Commit to adopt our error prevention tools, practice habits, and encourage others to do so as well. So as we review each tool, think, how will I apply this in my day-to-day work? You see, harm happens in healthcare. Over 8 years of study has shown that there are over 250,000 deaths per year. And these are due to medical errors that could have been prevented. And that's just in the US. 1 in 10 patients are harmed in the hospital every day. And 254,000 workforce injuries are also recorded every day. So this statistic shows that healthcare environment is not a very safe place to work in. This is like a 747 crashing every day. Anyone who doesn't know what a 747 is? So 747 is like the large airplane, friends. So this is not only Sutter Health, but this is across the country.
Can I ask you whose statistics those are?
Oh, this is actually from
Health and Human Resources?
no, it's a study from, I think, John Hopkins.
Okay.
So in 2016, on average, one of our Sutter Health patients is seriously harmed every 3 days. Now this is just Sutter data.
Sutter Hospital
Every affiliate. And a patient dies every 12 days due to preventable errors.
That's sad.
So always remember that safety starts with you. Oh, hold on.
This is working.
We need the audio. So this video shows our leadership from the Sutter Health Organization talking about safety and their vision for a safe culture.
Far too frequently, we open the newspaper and read an article about someone's loved one who goes in for care at a medical facility only to leave more injured than when they arrived. What we don't read about is the profound impact of the harm event on the caregivers themselves. And let's not forget, that patient's injury might be a fractured bone after a fall, or equally troublesome, fractured trust after personal health information has been mistakenly shared.
There isn't a single healthcare system in our country that isn't working towards safer patient care. And at Sutter Health, we've recently implemented the electronic health record, barcoding, and universal protocol to do just that.
Each one of us comes to work every day to care for people, to do a good job. We don't intend to harm anyone, but we're human and we make mistakes.
Harm happens, and it's far too easy to get in the mindset that it doesn't happen here.
Or that we have policies and procedures to prevent that harm. Or, I would never make that mistake. But let's face it, the truth is, harm happens everywhere, and harm happens at Sutter Health.
Here are some of the stories of grandparents, siblings, parents, and children
That have been harmed on our watch.
Harmed on our watch.
harmed on our watch.
Susan, a grandmother, was admitted for cancer treatment. She was in the final stages of cancer, so her children made the difficult decision to place her on comfort care. She was placed on medication to control her pain and ease her breathing. 2 nurses set up the high-risk medications in the pump. Unfortunately, the medicine was flowing freely, even though the pump display indicated it was infusing at the expected rate. Within minutes, the entire bag of medication was administered. Susan died as a result. Her children and grandchildren did not have the chance to say their final goodbyes.
David was admitted for confusion and was determined to be a high risk for falls. As a safety precaution, he was moved closer to the nurse's station. However, other fall prevention interventions were not followed, and the bed alarm was left off. He got up to go to the bathroom without calling for help, and he was found sometime later on the floor with a severe head injury. David died as a result of his injuries.
Ida, like many seniors, decided to have cataract surgery to help improve her eyesight. During her procedure, the surgeon was inadvertently provided the wrong dye, and it was placed in Ida's eye. As a result of this medication error, Ida was permanently blinded.
We administer thousands of medications safely each and every day. Unfortunately, Jose, an 82-year-old grandfather, was being treated for a clogged renal dialysis access site. He was taken to interventional radiology for treatment. During the procedure, he was accidentally given 25 times the amount of the high-risk anti-clotting medicine, heparin. Jose suffered severe complications and died as a result of the medication error.
Jody is a college student who was brought to the emergency room for acute anxiety. During the assessment, she was tearful. She said she was depressed and had been having suicidal thoughts. She was placed in a room to wait for a physician evaluation. Unfortunately, she was left alone with several bottles of medication that she had brought with her. She swallowed all of the pills and was found on the floor by the care team. Thankfully, Jody was promptly treated and recovered. Janet was good about taking care of her health. At 70, she visited her physician to have a routine test to check for blood in her stool. The test result came back positive, which means follow-up is needed to find the source of the bleeding. Unfortunately, this information was never communicated to Janet. Over the next 8 months, Janet routinely visited the doctor and was even hospitalized for another reason. Over all this time, the results of the test were never discussed, and follow-up tests were never ordered. After many months with progressive weight loss and difficulty eating, a large malignant tumor was found in her stomach. Sadly, Janet did not live to play with her grandchildren.
18-month-old Matthew was brought to the emergency department by ambulance for seizures. The care team was actively treating him, and the physician was in the process of ordering an anti-seizure medication. The team was working quickly, and the nurse inadvertently pulled the wrong drug, one used for sedation. While administering the medication, the nurse realized it was the wrong drug and stopped giving it. Fortunately, Matthew was resuscitated.